Hi, and welcome to ABC Care's Continuing Education Course Series. At ABC Care, we're passionate about providing the highest quality care, and that starts with supporting you, our incredible caregivers. We believe ongoing training isn't just a requirement, it's a valuable opportunity to grow your skills, build confidence, and provide the best care possible to those who depend on you. In this course series, you'll find important topics designed to help you stay informed, be prepared, and empowered. From infection control and communication strategies to supporting individuals with Alzheimer's and understanding caregiver burnout, we've created these courses with real-life caregiving situations in mind. Whether you're brand new to caregiving or have years of experience, we want you to feel supported every step of the way. These lessons are flexible and easy to follow, and we've included quizzes and resources to help you retain what you've learned. Thank you for your dedication, your compassion, and the meaningful work you do every day. Now, let's get started. Your first course begins here. Welcome to Bloodborne Pathogens, Training for Caregivers. In this course, we will review what bloodborne pathogens are, how they're transmitted, and how you can protect yourself and your clients for safe practice. What are bloodborne pathogens? Bloodborne pathogens are microorganisms that live in human blood or certain bodily fluids and can cause serious diseases like HIV, hepatitis B, and hepatitis C. As caregivers, it's critical that we understand how to avoid exposure. How are bloodborne pathogens transmitted? Pathogens don't just spread through direct blood contact. Improper handling of contaminated laundry or even shared personal items like razors can result in transmission. Transmission occurs when infected blood or bodily fluids enter another person's bloodstream, often through cuts, sores, or mucous membranes. These pathogens enter the body through broken skin, eyes, mouth, or nose, often through needle sticks, cuts, or contact with contaminated fluids. Needle stick injuries are a common cause of transmission. That's why careful handling and barrier protection are essential. Understanding OSHA regulations. OSHA's Bloodborne Pathogen Standard is the federal guideline to protect workers from exposure to infectious materials. Employers are required to provide training, PPE, and have an exposure control plan. Understanding your right under OSHA helps you stay safe and informed. Potential exposure risks for caregivers. As a caregiver, you may be exposed to bloodborne pathogens while assisting with personal care, dressing scrapes and wounds, and toileting needs are just to name a few. Potential exposure can also occur while handling waste like changing soiled linens, and exposure can also occur while cleaning up blood or bodily fluids. Understanding these risks help you to stay safe. It is important to stay aware of your surroundings and clean as needed to help you and the client maintain proper protection. Cleaning linens and spills immediately will aid in keeping everyone safe. More importantly, wearing the proper equipment and using proper cleaning chemicals is vital for a safe environment. The emotional impact of exposure. Mental and emotional effects of exposure are fear, anxiety, guilt, remember to seek help, always report an exposure incident, and know that you are not alone. Exposure incidents can be emotionally distressing. That's why reporting and seeking support are just as important as physical safety. Common bodily fluids to treat as infectious. Any bodily fluid visibly contaminated with blood should be considered potentially infectious. These bodily fluids may include blood, semen and vaginal secretion, cerebrospinal fluid, amniotic fluid, and saliva. Always err on the side of caution and use protective measures when in contact with these fluids. Standard precautions. Treating all bodily fluids as if they are infectious will help keep you safe. Always wear appropriate personal protective equipment and practice frequent hand washing before and after providing care. This includes consistent use of gloves, hand washing, and following strict cleanup protocols. Personal protective equipment, also referred to as PPE. PPE is your first line of defense. Use gloves, gowns, masks, and eye protection as needed when you expect exposure to blood or bodily fluids. Always wear PPE when assisting with tasks that may involve exposure. Properly dispose of used PPE in designated containers to avoid cross-contamination. Exposure control plan. Every workplace must have an exposure control plan. It outlines exactly how bloodborne hazards are managed, what PPE is required, and what incidents are reported and documented. Proper hand washing technique for caregivers. Hand washing is one of the simplest and most effective ways to prevent disease transmission. Make sure to start with wet hands and apply soap generously. Scrub all areas of your hands for at least 20 seconds. Make sure to get under your fingernails and in between each finger, and sometimes up on your wrist. Make sure to rinse thoroughly. And dry with a clean towel. Wash thoroughly before and after each interaction, even if you wore gloves. Proper hand hygiene helps prevent the spread of infection. Handle sharps safely. Caregivers may handle lancets or needles for clients with diabetes. Never recap used needles. Dispose of them in a sharps container, and report any accidental injuries right away. What to do if you are exposed. If you experience an exposure incident, wash the area immediately. Report the incident according to your employer's guidelines, and seek medical evaluation. If you come in contact with potentially infectious materials, act quickly. Wash the area thoroughly, flush the eyes or mouth that's exposed, and report the incident to your supervisor. Early reporting is essential for treatment and documentation. Cleaning and disposal procedures. Always use gloves and approved disinfectant when cleaning blood or bodily fluids. Clean spills immediately. Dispose of contaminated items in proper biohazard containers to prevent further exposure. Hepatitis B vaccination. The hepatitis B vaccine is highly effective and recommended for all caregivers. If you haven't been vaccinated, ask your supervisor. Vaccine series are available. Consult with your healthcare provider on how to get started. Employer responsibilities. Your employer should provide personal protective equipment, offer trainings and vaccinations, and maintain sharps disposal containers. Agencies like ABC Care are responsible for ensuring caregivers have access to proper equipment, training, and support to prevent exposure and stay safe. Ask your coordinator for assistance if needed. Real-world scenarios. Let's consider common caregiving scenarios. Your client has fallen and hit a sharp corner on the table on the way down. Would you know what to do if your client bled after a fall? You assist a client with glucose monitoring and accidentally stick yourself with the lancet. Would you know what steps to take? A common caregiver scenario is vomiting or diarrhea accidents. What steps would you take to clean up after your client got sick in their bed? What is the best way for both you and your client to be protected? Standard precautions should guide your every step. Myth-busting common misconceptions. Bloodborne pathogen myths. You can get HIV from casual contact. Gloves are always enough protection. Only doctors are at risk. Let's bust a few myths. No, HIV isn't spread through hugging. And yes, caregivers, not just doctors, can be at risk. Key takeaways. Key takeaways from this course include: always use standard precautions. Protect yourself with proper protective equipment. Act immediately when exposed. Stay informed and up to date. Remember, always use standard precautions, wear appropriate protective equipment, and report exposure promptly. And continue your education to stay safe and protect those you care for. Thank you for completing this important training. Your safety and the safety of those you care for depends on awareness and proper action. Next, you'll take a short quiz to review what you've learned. Once you pass the exam, make sure your coordinator receives your certificate. Be safe, be protected. For any questions, please reach out to your coordinator.